So guys, before we gonna go to our proper administration, I must first discuss to you guys what is the overview of subcutaneous administration. So subcutaneous injection is a method of administering medication in subcutaneous way, means under the skin. In this type of injection, a short needle is used to inject a drug into the tissue layer between the skin and muscle. Medication given this way is usually absorbed more slowly than IV, sometimes over a period of 24 hours. This type of injection is used when other methods of administration might be less effective. For example, some medications can't be given by mouth because acid and enzymes in the stomach would destroy them. Other methods like IV can be difficult and costly. For small amounts of delicate drugs, a subcutaneous injection can be useful and safe. Now, in preparing for subcutaneous injection, we must first take into consideration the location of injection. The drug needs to be injected into a fatty tissue just below the skin. Some areas of the body have a more easily accessible layer of tissue, where a needle injected under the skin will not hit muscle, bone, or blood vessel. The most common injection sites are abdomen, at or under the level of the belly button, about 2 inches away from the navel. At the arm, back or side of the upper arm, and thigh from the thigh.
Good afternoon, sir. I am Nicolas Garcia, licensed pharmacist here in a hospital. I'm the one who gonna administer your subcutaneous medication. Sir, are you experiencing some allergies of the one that prescribed you? Are you allergic to some of these active ingredient or not? Let me know, sir, if you are allergic, um, so that I'm gonna ask my colleague if what is the alternative counterpart of your medication in order for you to not experience allergic reaction. Thank you, Sir Nico, for informing me or asking me if I am allergic of some of the active ingredient that my doctor prescribed me. Good to say that I am not allergic of one of them, so you may proceed on administering my medication.
First step on how to administer subcutaneous injection is first we must wash our hands. Wash your hands with soap and warm water to prevent potential infection is good. Be sure to thoroughly scrub between fingers, on the back of the hands, and under fingernails. The Center for Disease Control and Prevention recommends lathering for 20 seconds, the time it takes to sing happy birthday twice. The next step is you may gather your supplies, which is syringe, surgical gloves, the vial or the medication, some cotton, and of course, alcohol. Or you may also use surgical gloves in administering this medication. Next step is clean and inspect the injection site. Before injecting medication, inspect your skin to make sure there's no bursting, burn, swelling, hardness, or irritation in the area. Alternate injection sites to prevent damage to an area with repeated injection. Then you should clean the skin with an alcohol. Let the alcohol dry thoroughly before doing the injection.
Sir, can you please lay down so that I can easily inspect your skin for if there is bruising or wounds or burns. Okay, sir.
Next step is prepare the syringe with medication. Before withdrawing medication from a vial and injecting yourself or someone else, make sure you're using the correct medication at the correct dose at the correct time and in the right manner. Use a needle and syringe with every injection. After preparing your syringe, now you will remove the cap from the vial. If the vial is multi-dose, make a note about when the vial was first opened. The rubber stopper should be clean with an alcohol swab. Next step is that you will draw air into the syringe. Draw back the plunger to fill the syringe with air up to the dose that you'll be injecting. This is done because the vial is a vacuum and you need to add an equal amount of air to regulate the pressure. This makes it easier to draw the medication into the syringe. Don't worry, though if you forget this step, you can still get the medication out of the vial. Insert the air into the vial. Remove the cap from the needle and push the needle through the rubber stopper at the top of the vial. Inject all the air into the vial and be careful to not touch the needle to keep it clean. Next step is that you will withdraw the medication. Turn the vial and syringe upside down so the needle points upward. Then pull back the plunger to withdraw the correct amount of medication. Next step is that remove any air bubbles. Tap the syringe to push any bubbles to the top and gently depress the plunger to push the air bubbles out. Next step is that when you're injecting the medication, pinch your skin. Take a big pinch of skin between your thumb and index finger and hold it. Your thumb and forefinger should be about an inch and half apart. This pulls the fatty tissue away from the muscle and makes the injection easier. Next step is that you will inject the needle. Inject the needle into the pinched skin at a 90-degree angle. You should do this quickly, but without great force. If you have very little fat on your body, you may need to inject the needle at a 45-degree angle to the skin. Next is that insert the medication, slowly push the plunger to inject the medication. You should inject the entire amount of medication. Next is that withdraw the needle. Let go the pinch skin and withdraw the needle. Discard the used needle in a puncture-resistant sharp container and apply pressure to the site using gauze to apply light pressure to the injection site. Or you may use alcohol with cotton. After the procedure, discard all the used equipments. Thanks for watching. I hope you learned something. Thank you guys.